May I come in?
Yeah.
Okay, good.
Yeah, I filled this out.
Oh, thank you. Thank you for doing that.
I just had a question, like, for the ACEs screener. I read the information, and I just want to know who will have access to these, like, my answers.
Yeah, thanks for asking that. It's sensitive information, absolutely. Yeah. So it's part of your confidential medical record, and our intention is to include the score so that the team of people taking care of you is able to kind of more holistically address your health needs. Yeah. Does that sound okay to you? Do you have other questions?
Yeah, I mean, I was also reading the information sheet, and like it talks about how, chronic pain and sleeplessness could also be related.
Yeah. May I see your questionnaire? Okay. Yeah, I see that you had you have an ACE score of 4. Yeah. So thank you for filling this out, and just to reflect back to you that as I said, we're asking these things because these experiences are so common. Yeah. So you're common among our patients in having had those experiences. And it sounds like you're wondering about the connection to your health issues. How do you, if you don't mind my asking, how do you feel like your experiences affected you?
I don't know, something you said, like, about tension, like I feel like sometimes where I have the chronic pain is the same. Like, I'll notice, like, my shoulders are like this or something, So yeah, it feels like it's in certain parts of my body. Yeah,
almost like you're bracing yourself, and then doing that in an ongoing way over time is kind of causing ongoing tension pain. I know. Well, isn't it interesting when we notice and pay attention, we actually can undo it a little bit? Yeah. Well, what's helped you in the past besides just noticing and letting it go? I'm even sitting up straighter now.
Yeah, I think I should notice it. I should practice noticing more. But one time I realized, like, there was like a stretch of 4 days where I didn't have any back pain at all, and that's because I was in Hawaii. I was like on vacation. Yeah. I feel like I should be able to do that while I'm home. Like, maybe I could have like little trips instead of like waiting for the big trip. Yeah,
well, that's really interesting. First of all, just to acknowledge that even just your awareness that you're describing is actually a really powerful tool for this and for all kinds of kind of unpacking the way our experiences affect our health. So that's really great. And it sounds like maybe you're even talking about, like, I don't know if you noticed on that list, but experiencing nature can actually help us regulate our tension and stress and physiology. So I think that's a really good idea. I don't know if you feel like there may be ways for you to build that into your life.
Yeah, I guess maybe instead of just like I could go for a walk in a naturey place rather than just like around the block.
Absolutely. Yeah. I mean, I wonder going forward, with your back pain, I think there's a lot that we can do in terms of like supporting your pregnant body. We can use, a support belt for pregnancy, for example. But I wonder if building this nature element and this kind of noticing element that you've talked about into things going forward will kind of help relieve pain as it comes up and help us kind of be able to better attend to it.
Yeah, I could give that a try.
Okay. Yeah, I think that sounds like a really great plan. You're talking about exercising too, and exercising and being in nature can also really help with your sleep. And if we improve your sleep, it can also really help with back pain, with pain in general. Yeah. So kind of the cool thing about this sort of more holistic web is that everything that you're interested in doing and already doing can help the other things, and we can kind of have like an upward spiral where we notice and support what's coming up.
I didn't think about how the nature could actually help my sleep.
Absolutely. Especially like if you can get natural light early in the morning when you first wake up. Just go outside for 5 minutes or 10 minutes. That can really help prime your sleep.
Okay.
And same with if we make your back a little more comfortable, you may sleep better. So it's all connected. Our earlier experiences are connected to now. All of the good stuff you're doing is connected to the other stuff. So I think you're doing really well.
Okay.
And I think a pregnancy support belt would actually be a really good idea too, just to help support your low back.
Sounds good.
Yeah. So does it feel good to kind of pay attention to those two elements? And we can, since your pain hasn't gotten any worse, I think just being proactive in those ways. and then kind of checking in at your next visit. Does that sound good?
Sure. Yeah.
Okay, cool.
Yeah, sounds
Anything
good.
else you wanted to talk about today?
No, I think that's it.
Okay.
Yeah.
Okay.
You've given me something to think about.
Yeah, you know, and about that, these ideas are kind of complex, so we can certainly address it again if you have questions that come up and things like that. This is just kind of planting seeds for an ongoing conversation.
Okay.
But you can see there's just so many levers that we have to enhance your health and to build on, so I'm feeling pretty good about it.
Okay. Me
Yeah.
too. Thank
Okay.
you.
Cool.
Thanks so
Yeah.
much, Dr.
Nice to
Johnson.
see you.